Hi, this is Jeff. I just wanted to give you an update on my ACDF surgery. I had C5 through C7 fused. The nice part of it was when I woke up, I was able to feel my hands, which was a great relief. The surgery took just over 2 hours. Actually, as you can see right here, I'm not wearing one of those hard plastic neck collars. My doctor said that these foam collars are just as good. He, matter of fact, prefers that I don't wear it. If you wear a collar 24 hours, 7 days a week, what happens is you take all the tension off the neck muscles and then your neck muscles become weak. So his recommendation was to wear the foam collar only when needed and keep the muscles strong in the neck by allowing it to hold your head. So that's what his thought process was. And so I'm gonna follow his. I do wear it when my neck starts to get heavy and it starts to hurt me. When I put it back on, I sort of feel better. I know some of you may think it's just psychological, but it's actually the truth. Try it. Anyhow, for those that are aware of what ACDF is and how the surgery is performed, they basically intubate you, move your larynx, your voice, move everything off to the side so they have clean access to your vertebrae. They put a small incision, it's about 2.5 inches, open you up, this way they have access to your vertebrae, and then they fuse it, and then basically put you all back together again. First night in the hospital wasn't too bad. You know, of course, when you've got these nurses that are waiting on you hand and foot and filling your IV with pain meds, you know, you're gonna feel just fine. What becomes more bothersome is when you go home and you have to do it yourself and put yourself on a timetable to make sure that you get your pain pills, make sure you get your muscle relaxers in time, and, you know, just letting one day at a time go by, I wasn't good at that. I prefer not to be on any pain management, but what was happening is all the pain pills that I was taking, as well as the muscle relaxers, all it made me do was sleep. I don't know about you guys, but you know, I'd rather be coherent and be up and be able to move around and do things. And so I have opted not to take the pain pills. What would you expect from the surgery? Like I said, after the surgery, I was able to feel my hands again. I mean, I had pain running down my pec, down the front of my bicep, down the back of my tricep, and all the way back to my scapula. And it hurt just walking. You know, just think about, you know, trying to run across the street with your head bouncing up and down, which just put all that pain on those nerves. So after 5 months, I decided to have the surgery. Let's see, so part of the instruction is when you go home, of course, you know, make sure that you've got a really, really good lazy boy chair to sit in, because I'll tell you, you're going to spend most of your time in it. Unfortunately for me, I don't have a high back lazy boy chair because when I say it's going to become your best friend, it's like that's where you're going to have to sleep. Because trying to sleep on a bed, it was just so difficult for me. I was getting up and go sleeping on the couch and trying to prop up the pillows and then put them down and go back to the bed. It was very hard. So make sure that you do have a lazy boy at home, or maybe a friend will let you borrow one. But now, you know, being out 8 days, last night, actually I slept half the night without getting up. Then I got up and I just took some Tylenol, then I went back to sleep. So it wasn't too bad. I'd say last night was probably the first good night's sleep that I've had. Let's see here. Shower. You can take a shower after the drainage has stopped. And actually my drainage has stopped, so I've been able to take a shower. I'm not even covering the bandage any longer with any dry tape or any gauze pads. So the only thing that I have are the strips that they've put on. I don't know why, but they didn't actually put sutures here. So I don't understand why, but I guess we'll see what happens. I hope I don't have like a big keloid that some people get. you know, from not stitching something up. If I do, then I may have to have plastic surgery. But my neck is definitely swollen. The surgeon said to me, whatever you do, if you're going to order breakfast, lunch, dinner, whatever, just make sure you go with something really soft. But for whatever reason, I decided, hey, pancakes can't be that bad, right? Guess what? It was the worst decision you could make. Eating pancakes and putting syrup, and it basically just makes a big ball. And then you eat it and try to swallow it. And when your throat is swollen as it is after the surgery, trying to push, let's say, 2 golf balls down your throat at the same time, it doesn't feel too good. So after the second bite, I sort of threw that away and said, hey, can I get some scrambled eggs instead? And that worked out much better. So going back, so I'm 8 days post-op. I am still having a difficult time swallowing. The swelling, of course, isn't as bad as it was when I first came home, but there is definitely swelling here. I don't know if you can see it, like this lump right here. So whatever you want to do, you know, just try to eat something soft. It seems that eggs, applesauce, you know, anything pureed is going to become your best friend. I was not looking to lose weight, but since I've had the surgery, I've lost 7 pounds already, and I'm 6'1", 180 pounds. So for me to lose weight, it really shows, and I don't want to lose any weight. And so I'm trying to eat as much as I can just to keep the weight on. So don't have the surgery because you're looking for a diet alternative. So this just isn't it for you, okay? Look for something else. Let's see here. So, so far so good. I mean, I am getting the pain in the back that other people mentioned, hence them giving you the muscle relaxers, but I don't want to take them. So I feel a lot more often, and it hits just like out of the blue. You'll be fine, then all of a sudden your back will just like 2 lightning bolts just connecting. You're just like, ah, what was that? You know, it hurts so much. But it comes and goes. It's like you'll have it for maybe 10 minutes, and all of a sudden it's gone for, who knows, you know, the next 24 hours, and then just hits you again for 5 minutes, and then it stops. So the muscle spasms that I'm going through, it sounds like it's pretty normal. Oh, one other thing I do want to bring up. I did see a video that somebody said that they were catheterized. So basically a tube shoved up your urethra. And I'm like, holy shit, I don't want to have that done to me. You know, from what I understand, it's like getting a garden hose and trying to put it into a straw. You know, it hurts that much. So I was not catheterized, which is good, especially since the surgery was only for 2 hours and 15 minutes. When I asked my doctor that question, he said, what? He goes, the surgery's just 2 hours. He goes, no, we're not going to catheterize you. So I'm sorry for the guy who did get catheterized. I think they were just fucking with him, and they did it. Anyhow, if you have any questions or anything like that, you know, please just go ahead and send them to me, and I'll try to respond, you know, as quick as possible. But so far, so good. I do have, you know, 90% of the feeling back in my hand. There's still some tingling, but my surgeon said that over time, that will go away. So, so far I'm happy. All I want is the swelling to go down, and I want to be able to eat a meal without having any problems. And then, you know, start physical therapy. A couple of the videos I mentioned, or a couple of the videos that I watched, their doctors didn't prescribe physical therapy. And my doctor absolutely said physical therapy. I want to get you back to the condition that you were prior to surgery. And I'm pretty active. I ski, I snowboard, I bike, I run, I swim. So it's important for me to be able to keep my activity level up. Anyhow, that's it for now. If you have any questions, just go ahead and leave them for me, and I'll respond to them. Speak to you next Monday. I'm going in for my 10-day checkup. Bye.